There is an important gap that still exists. The gap isn't research in how to do advocacy. The gap is in transmitting the knowledge that exists to advocates and potential advocates around the globe. What we all find is that what we take for granted in terms of knowledge about how to conduct a campaign to either get government or major organizations to engage in smart, evidence-based tobacco control policy isn't common knowledge around the globe. So it's not unusual as you travel around to find passionate, knowledgeable, skilled individuals and organizations who don't understand how to move their government forward or how to work with the media or how to build political coalitions. It's more than just transmitting the knowledge to advocacy efforts, because far too few people realize that there is a science to doing advocacy, but we have the science base. However, often people don't treat advocacy as something that there is a science knowledge base about how to go about it. An institution like Johns Hopkins could both give credibility to people appreciating that there is a science base, there is something to learn, then transmitting what it is, and then equally as important, training people around the globe to do it in ways that are appropriate for their political system and their culture. It's one of the biggest hurdles to progress in tobacco control in many countries. There are knowledgeable, passionate individuals and organizations, but they don't have a tradition of working to persuade their government to adopt population-based solutions. Learning how to do that in a way appropriate for their culture that takes advantage of what we know is one of the biggest gaps in public health in tobacco, but not just tobacco. You know, one of the hardest things in working with public health professionals is to get them to understand that the solution to many public health problems, tobacco is just one of them, are political and social, not medical and clinical. So if you're going to adopt population-based solutions, and those are increasingly the most important solutions for all of the risk factors related to non-communicable diseases and other major public health problems, you have to understand the political system and how political change takes place, and therefore you have to understand how to do political issue-oriented campaigns. That's not a skill that's widely understood throughout the world. Political change is always a challenge, particularly when you have an opposition, and we in tobacco always have an opposition. But it doesn't matter the political system. The challenge to an advocate is to figure out, given who is in power, what they believe and what motivates them, how do you develop your public health argument in a way that will persuade them? And we have seen across the globe that you're capable of doing it in open, thriving democracies, but you're also capable of doing it in countries where government officials aren't responsive to the public in the same way. So we've seen a good deal of progress in the last 4 or 5 years in countries like Russia or Vietnam that you don't think of as countries where the governments are responsive to public concerns and public pressure. The reason they're successful is in fact that we and Hopkins and others have been able to work with advocates in those countries, learn from them about their system, learn from them about the unique nature of decision-making in their country, and transmit to them the skills and knowledge base about how to take that knowledge to develop comprehensive, effective campaigns appropriate for their country. We are trying to document it because it is very important, I think, to do so for a lot of different reasons. In the end, outside donors, outside advocates can serve as a catalyst, but unless you build capacity within those countries, then we won't see long-term change. Equally as important is that there are misconceptions that you can't do the kind of advocacy necessary to bring about change in certain political systems. That's not true if you do it right. One of the keys to good advocacy is always being a good listener, asking the right questions, and adopting your strategies to the local culture, political system, and interests. Having said that, once you've done that, then it's critical to understand that a key campaign involves, identifying the issue with solid science, identifying a solution with solid science, and doing the political mapping to understand how decisions are made in that country and to what political officials respond to in that country. When you've done that, then you have to work with the local culture to build the kind of pressure, public support, media attention that's necessary. You can do that in whether or not it's an open and thriving democracy with a free media, or if you're careful, you can do it in a closed country where the government controls the media. Indonesia is a country that is one of the most challenging countries. It is probably the most backward nation in the globe on tobacco control at the moment. The central government has not been responsive. The media, however, has been very responsive, and so many of us working with the media in Indonesia have changed the public discussion and public debate. And what we have seen there is, while we have not seen major steps forward at the national level, we have seen significant steps forward in a number of major cities in Indonesia, and that can serve as a building block for long-term change. You have to seek out victories where they're achievable and understand what the building blocks for bigger achievement will be long-term. You know, public health isn't for the faint of heart. It isn't for those people who have a short attention span. Whether you're in the United States or outside, you know, we've had enormous victories in Russia that looked like it happened instantly, but took 4 years of solid work behind it. In the United States, it took us over a decade to get our Congress to pass legislation giving the U.S. Food and Drug Administration authority over tobacco. So if you're going to succeed, you've got to act as if the problem is urgent, but be prepared to be in it for the long haul. There's a critical question that people always start out, and that is, can you transmit knowledge about how to do advocacy? And my answer is, not only can you, but if public health people are going to be successful, they have to. Prepare to get your hands dirty. If you're not willing to get your hands dirty, don't call yourself a public health leader, because you won't succeed.